Bringing us now to our final keynote. As people know, Nancy Greene Raine will be providing that, and her talk is going to be entitled Marketing to Children, What Civil Society Can Do to Help Support Healthy Public Policy in Parliament. I don't think I need to give any further introduction, but we'll highlight again that Nancy is a former senator and Olympic icon who was named Canada's Female Athlete of the 20th Century. She has a passion for the promotion of health and fitness and established the National Health and Fitness Day in Canada. And as we've heard several times, her bill to prohibit the marketing of unhealthy foods and beverages to children is currently before the House of Commons. So please join me in welcoming former Senator Nancy Greene Raine.
Well, thank you very much. I have to say, first of all, it's been a real pleasure for me to be here today. I feel so privileged to sit in this group because I know I'm amongst people who, first of all, really care about what's happening with our food policies and with people who have expertise in all kinds of areas. And, you know, there's how many people here are doctors or doctorates? Raise your hand. Okay, how many people here are dietitians or public health specialists? And how many people here are students? And how many people here are grandparents? And so I look around and there's so much diversity just in this room. And I really believe that when we're looking at how a country goes about feeding itself, we really, it's a huge, vast subject. And I feel so good that Health Canada has worked hard in the last few years, and a special thanks to Hassan and to Will and the work you're doing to pull it together in a strategy for health, a real strategy for healthy eating, which is what it's all about. I think I just happened to be in the right place at the right time. First of all, I heard there was going to be a conference in Ottawa. A friend of mine, Tom Warshawski, I'm sure you know of him, a Childhood Obesity Foundation, mentioned it to me, and I said, can I go to that? He said, yeah, you should go to that. So anyway, I got myself invited, and I was only able to drop in for a few sessions, but I could see there was an energy in that room and a determination to do something about the childhood obesity. And when they came out with the Ottawa principles, and I looked at them, and I said, wow, this is great. So I started ragging on a few of my colleagues who were on the Social Science and Technology Committee, Social Affairs, Science and Technology in the Senate. I wasn't on that committee, but I started saying, you really should be doing a study on the rising rates of obesity and getting information. And I think I contacted a few people here quite early on to give me some information and send it on. They decided to do the study, and I started going to all the meetings, so they let me come on the committee. And then when we came out with the recommendations, and there was this one saying, stop marketing to kids. And of course, the coalition was just forming at the time. And I said, this is really the low-hanging fruit on what we can do. It's not hard to change that issue if there's a will to do it. And I just sensed, and everybody I talked to started saying, go for it, go for it. And I said, the time is right. So I really feel privileged to have been able to kind of lead the charge a little bit, but I couldn't have had any power or momentum if there weren't so many good people behind me giving me the information and the help. And I'm kind of a person that likes to talk to people, so wherever I go, whether it's a taxi driver or riding up the chairlift with someone or just chatting with people, I'll say, yeah, I'm thinking of doing this bill, what do you think? And everybody said, oh my God, that would be so great. I'm so tired of my kids nagging at me and, you know, new Canadians driving a taxi. Yeah, it's really hard here. There's so much advertising for food. And you start to think about it and you think, okay, so go for it. And, you know, I'm so choked right now because I really thought it would be finished before I'm finished. But when you turn 75, you're out of there. In fact, I'll share a funny story because my birthday was May 11th, which was on a Friday. So on the Thursday, there was tributes and things like that, and I left because the Senate doesn't normally sit on a Friday. But as it turned out, we had to sit Friday. And so they're scrambling around saying, who can come on Friday? And I said, well, I can be here on Friday. I'm going to be in Ottawa anyway. I can go. And I said, you know, my birthday's not till tomorrow, to, I think, my whip. He said, okay, put my name down. So I come marching into the Senate on Friday, and I'm there for the prayer, and then the clerk looks at me, and she goes like this, and she comes running over. You can't be here. You can't be in front of the brass rail. You're retired. I said, well, no, I wasn't born until the evening. My time's not up yet. That was at 9:01. At 9:07, there was an email to all senators that Nancy Raine's term ended at 11:59 p.m. the night before. But it was fun. It was kind of... And I've been very fortunate through all of this to have a couple of staff that have helped me do what I've been doing. But when I think of the timing and how you, as people who really care about this kind of issue, and I'm sure there'll be more, if we get the marketing to kids one done, there'll be other issues that you really have to push for, and because it is hard. And so how does it work? Well, you need to find a champion. It helps. And I can tell you, don't overlook the Senate. The Senate has gotten a lot of you know what I mean. The Senate has been under attack ever since it was founded. The Senate was founded by our fathers of Confederation, who set up a second chamber to be different than the elected members of Parliament who were to represent by population the citizens of the country. The Senate was set up with 4 distinct regions: Atlantic Canada, Lower Canada, Quebec, Upper Canada, Ottawa, and the West, which was not that populated way back then. And so it was set up to be regional. And very, you know, I would say within, I don't know how many, 20 years, there were people criticizing the Senate. And in a way, the Senate, it gets criticized partly because it doesn't promote itself very much, because they don't have to go out and get reelected. And you can think of the Senate as kind of a think tank of people drawn from all kinds of walks of life, mostly educated, successful people who've had a career, put into the Senate at the end of their career to collectively analyze and do a sober second thought on legislation, and also to work on the committees. And in the committees, you study public policy. So I can tell you there are people in the Senate who have tremendous backgrounds in this field of public policy and nutrition, people who care. We have a senator who recently discovered she had diabetes, for example. And, you know, like all of us, go to the family doctor, what do I do? And, you know, it's pretty traumatic to find out that. And being a very intelligent person, started to go online, do her own research, and come up and say, you know what? I think I'm going to go and try to, first of all, go to the gym every day, and secondly, watch what I eat. And she was put on medications, but she's no longer on her medication. She's monitoring it with her doctor in lifestyle changes. She will be a great advocate as you move forward. Senator Yana Martin from Vancouver. So there are other people. I can tell you there are many other people. We have a senator who's a great advocate for fitness. He's run 59 marathons, including this year. He wants to run 60 marathons before he retires. So there's lots of interesting people in the Senate. So the Senate is an opportunity where you can, if your issues need study, propose them for a Senate study. They can look at it. They have access to great researchers. And when people testify before a Senate committee, the senators ask very probing questions to draw out the expertise of the witnesses. They're not trying to score points politically because they've got 3 minutes and they're on TV. And I think that's kind of what happens in the House of Commons. So the Senate committees have done good work, and I'm sure you know about Senator Keon's work on the social determinants of health, which is always quoted. I introduced the bill in the Senate. It then went through 3 readings in the Senate and was voted on and moved over to the House of Commons. It had first reading. The first reading, it's introduced. The second reading, there's a debate, and it's a debate on the principles that are being that are in the legislation, and then it goes to committee for study, and it comes back for third reading. I really expected it to be at third reading today, and if necessary, be voted on tomorrow. And then I believe the House is planning to rise. It didn't, it got bumped off the agenda today, so hopefully it'll be on third reading tomorrow. If the Senate decides to send the marijuana legislation back again, forcing the House of Commons to stay again, did they? I hope you're not happy. No, because anyway, there was one last kick of the can maybe. But it looks like, I mean, that's a legislation that I've been very concerned about. And I mean, you know, it's just when yeah, okay, thanks. I would suggest that it's highly unlikely. The only chance of my bill getting through tomorrow is if the debate collapses and they quickly move to a voice or a voice vote and it gets passed. But if anybody, 5 people rising, and it has to go for a standing vote, so that'll be next September. But anyway, I think it'll get through. And there certainly has good support. And my party hasn't supported 100% because in the Conservative Party, there are people who are concerned about big government, too much regulations, and there's a lot of people talking about nanny state, and it's up to the parents to do this. But I can tell you, I've never met a Canadian yet that didn't think that publicly funded healthcare is a bad idea. It seems to be part of our culture as Canadians. And if we're paying for healthcare, it behooves us to do everything possible to keep people healthy. And certainly the targeted marketing of young children doesn't help. So I think it will get through eventually, and I'll be watching. I really appreciate the work that's being done in Health Canada in terms of preparing for the regulations. Because in the bill that I put forward, first of all, I put it forward as under 13, because I was, even though the Ottawa Principle said under 17, I thought, you know, under 13 was already established. It had gone to Supreme Court from the Quebec legislation and had passed Supreme Court as it's manipulative to market to kids under 13. I had thought it would have a better chance of passing. The Minister of Health in the new government that came in asked that it be moved up to under 17. So last June, I amended my own bill to move it up to under 17. One of the reasons why I was comfortable doing that was I started reading and hearing about the new algorithms that were allowing the social media and electronic, the internet, to actually target individual users with directed advertising based on the mood the kid was in when he's on his computer, and knowing that highly caffeinated beverages and marijuana is coming too, and the targeting of all of these things to the teenagers, where they, for the first time, they have their own spending money, that was going to be problematic. So I agreed to amend it to under 17. There was a change, and the new minister came in and said, want it to go back to under 13. So that was why it was amended again, and that's where it's at now. I also, and Mary and I have had conversations on this, and you've been just wonderful, Dr. Pack. I just appreciate so much what you did with the World Health Organization and everybody you've been working with. And you know, this is a real champion. To understand that if you put that database together, how it could be used to help validate the research that's going on in defining what is unhealthy with regard to targeting to kids. I put in all advertising, all foods, because I kept saying to people, well, there's no marketing for fresh apples and carrots and things like that. There is virtually, it won't impact that marketing. 95% of the marketing to kids on the food category is all unhealthy foods. But once I saw what Mary had done, now you have a definition of unhealthy. I also agreed to amend my original legislation to put in unhealthy and define it. that does two things. First of all, it's more likely to not be challenged in Supreme Court, and secondly, it really does target and define what we're after here. But I could have done that if you hadn't done your work to define unhealthy. So thank you so much. And that's why I say I'm really lucky that I came along at the right time. Now I don't want to just divert from a little bit, and you guys know that I was an Olympic skier and all that stuff, but you don't know my background. I grew up in a small town with a stay-at-home mom with 6 kids. I grew up in the post-war years where we had our own garden, and my mom, we didn't even have a fridge. We had a meat safe in the back porch, a screened container where the meat would sit out there, and my mom would go down and pick it up at the meat market, and they would buy meat, and the meat market in town had a freezer. You could freeze your meat, and we would go in after swimming on a hot day and go into the freezer and go into my mom's locker to get the meat for the 2 days later, and it would thaw out. So, it was a completely different world. And kids played outside, kids were active. We knew if we hung around the house, my mom would give us a chore to do, so we went playing. And all the kids in town were the same. We played all over town. And, when it was getting time for supper, you kind of drifted towards home, waiting for the whistle or the horn to honk or whatever your parents did to call you in for dinner time. We didn't hang around the kitchen asking for snacks. And when I see my grandkids and I see them, and my daughter-in-law is trying to make dinner, and they're begging her for a piece of cheese or a this or a that or a cookie or a cracker, it's a different world. And we have to recognize that. And I know that the tools that are out there that are creating this situation in kids, if we can curb that, it will help. But I was pretty excited today when you're talking about innovation and how you can actually use social media and the devices and all of the things that are happening in the technology world to also help us going forward. So we are, we're never going to go back to the way it was. It's crazy to even think that you can. As a grandparent, I know myself, when my grandkids come and ask me for candy, I'll say, here's a piece of apple or a carrot or whatever, because I'm not their mom. I can send them home wired on sugar, but I won't. And we need to do that when we're caring for kids, other people's kids. So it's really important that the schools, the recreation centers, the daycare centers, all of the people that are dealing with kids, it's really important that they start to learn this. And don't forget about the coaches. I get so mad when I see the ski team, the ski club coaches in my own club, and the kids come over and, how was my run? Oh, you had a great run. Here's a speed bean. And they give them a jelly bean. You should not reward children's performances with candy. And we need to make sure that that's part of the ethos and the ethical values of coaching. You look at heroes and champions. I was so disappointed when the fabulous middle distance track star, I forget her name right now, the young woman that we have who's doing so well, signed a contract with Red Bull. And I was so disappointed a few years ago when our top skier got a contract with Red Bull. But Red Bull is offering millions of dollars to these athletes who know their career is very short and they can't say no. So, it's hard. I know that there's a desire among a lot of the politicians who've been lobbied by sport to exclude the marketing, the prohibition on marketing to kids, to exclude children's sports programs from that prohibition. I don't agree with that. And I know that that's the elected politicians. When the people from the fast food outlets in their town call on them, when the soccer coaches and the soccer moms are told to, by their association, lobby your member of parliament, tell them, let us have the sponsoring that we have in our kids' sports. it works. So we have to make sure that the regulations that are around that, first of all, I'm so happy that there is going to be a 5-year review period, and the regulations around it have to be very, very limited. In Olympic sports and in World Cup sports, you can have a sponsorship Red Bull on your helmet or your hat, but it can only be a certain size. It can't be really big. Okay, so Tim Hortons, Timbits. If you let the kids have Timbits, eat Timbits on their shirts or on the banners, that's one thing. If it's just thanks to Tim Hortons sponsorship, small print, I'm okay with that. If they're really doing it for the good of the kids, they'll keep sponsoring kids' sports. If they're doing it for the health halo effect, if they're doing it for the actual marketing effect, and many of them are, then they'll stop doing it. But it was the same thing when they took away the cigarette advertising for the arts. Sport prohibited cigarette advertising before it was mandatory. But the arts and cultural groups and things, they were panicking. They were losing all their big money sponsorships. They all found more sponsorships. They're out there. They're harder to find. The junk food, the soft drinks will come knocking on the door of the sports club. You have to get up off your chair and go out and knock on a few doors. But there are people in our communities that will help kids' sports and the arts, kids' arts programs. All of those programs are good for kids. It's not just sports. The dance programs, all those things. So I think civil society can work on that. You need to work at your own community level to say, I want my kid to play sports, but I don't want him being subjected to a lot of advertising of junk food. We're against this. And work at the club level for that. The other thing I wanted to mention was, because I sat on the Aboriginal Peoples Committee the whole time I was in the Senate, and traveled up north to Nunavut and Nunavik and all across Canada. And it is really hard when you see a cultural change in lifestyles and habits that has had a really serious impact on their health. And, if we are subsidizing any food going up to the north of 50, I guess, or 40, it shouldn't be unhealthy food. We should be, these are just the way I feel about it, but we have healthy products that they can use. Pulses, beans, all kinds of products that can be sold, dried vegetables, okay? And there's ways of preserving food that isn't unhealthy. But to think that we should be having fresh fruit and vegetables in the north where they don't grow doesn't make sense. And I kind of suspect that the people that are influencing the decision making are people from the south who are working in the north or who are living in the north, and they want what they could get down south. But the diet of people in the north didn't include those things. So we need to really do a good job on that. Because there's things to do. I did make a few notes here. Oh yeah, I wanted to just mention that I've had a lot of input from my family over the years, and I have a wonderful daughter-in-law. No, sorry, it's my brother's wife. And one day I was chatting with her, and she turned to me and she said, "Did you just shit on me?" And I went, "What did you say?" She said, "Well, you always say you should do this, you should do that. You're shitting on me." And I thought, Nancy, don't tell people what to do. Everybody is different. Everybody has their different own experiences. We come from different backgrounds, different genetic makeup. We need to be very careful about dictating, and we really need to find a way to inspire and to motivate for everybody to get involved. And one of the things that I really enjoyed in my Senate term was working with a nonpartisan group. First, we started the Parliamentary Fitness Initiative, where we call on members of Parliament to go for a swim. We've got a little program for them to be active themselves while they're in Ottawa, and to talk about and tell them they should be leaders in promoting health and fitness. We started the National Health and Fitness Day to engage federal politicians to discuss at their municipal level, to have a day and promote health and fitness. You can only do so much at the federal level because of our, the provinces have jurisdiction for health and for education. The federal government can only do so much, and federal politicians can only do so much. But there is a linkage, and there's a way to talk and to motivate. And so I'm going to stay involved in that group and staying active in that field. And it is really important to get a lot of people involved. But I want to go back again to, I grew up with a certain thing, and when I had my kids, well, I won my medal, retired without much thought, and immediately got involved in all kinds of commercials, Mars bars, etc. That's a whole other story. But, and then anyway, within a year, got married, 9 months later had twins, and then eventually moved out west to live next door to my mother-in-law, and got a flyer in the mail, free cooking classes. I said, I should take that every Wednesday night. So I said to Fran, would you babysit so I can take these cooking classes? No problem. So off I went every Wednesday night, and I took cooking classes. That was the best thing that happened to me when I was a young mom. It was the Seventh-day Adventists. They taught you to cook from scratch. I started going to the health food store and buying stuff. I didn't ever get into grinding my own flour, but almost. But I knew that you didn't buy flour and have it sit for months in your cupboard. It's something you should be fresh. And I learned those things. I bought the Adele Davis cookbooks and all of those kinds of things. You learn things. And then as you go through, that way of cooking is not that hard, and it's very, very affordable. But you have to learn how to do it. So I'm really excited that there's so many young people in the crowd that were here all day today. That's the challenge, is to get back so that we can figure out how to use what we can buy that's healthy and cook it and have meals from scratch. And I keep thinking, and now that my daughter-in-law is doing this, now she's starting to cook healthy foods, and she's got the kids involved, and they're helping her. And my dream is that the kids who come home after school when they're teenagers will cook the meal for the parents, nice, healthy meals. The parents can come home and there it is, all cooked, because the kids knew how to do it. So that's where we're going. But anyway, it is really, really a great feeling to be here today and to first of all meet the other speakers who are, you're my heroes, really. And then to know that there is an interest in this and that we'll all keep working together. And that's all really I have to say. Big thank you especially to Mary, to Hassan, and Kim. I don't think we are closely related, but I will tell everybody that you're my cousin, or you're my niece, absolutely. And as I say that, thank you, Norm, for all the work you did, and all of you that have organized this conference. It was great, and there's a lot of work still to be done, and you know that you're not alone. The group's been amazing. So if anybody has any questions, do I have any time? I don't need any questions. No, I think it's time to go. So thank you very, very much for having me. It's been a real pleasure.